Good. Welcome, our distinguished guests, colleagues, and friends. It's an honor to be with you here today. We are discussing the timely question: should national healthcare systems mandate genetic screening for breast cancer in high risk populations? And we are pleased to represent the negative team. We are Sahar Al Khatim from Sudan and Rachel Mtama from Tanzania. And as we are talking about breast cancer, we know that it's a major health concern, especially in Africa, with a prevalence of 2.3 million newly diagnosed cases annually worldwide. No one could argue against the importance of genetic screening. Certain genetic mutations significantly increase the risk of developing the disease, and genetic screening can actually identify individuals with these mutations, enabling early intervention, personalized treatment, and preventive measures. So, in the negative team, we encourage and support genetic screening. However, mandating such screening could violate individuals' rights and autonomy and raises important ethical, practical, and financial concerns. As the negative team, ladies and gentlemen, we stand against the motion. While, as I said, we acknowledge the potential benefits of genetic screening, we firmly believe that mandating it is neither ethical nor practical and could create more problems than it solves. And that is what we will confirm through our arguments. We have three major concerns: the ethical concerns, financial concerns, and practical concern. I will talk about the ethical concerns, and Rachel will explain the economical and practical concern. When it comes to ethical concerns, we have three major points. The first one is mandating genetic screening violate individuals' right to make informed decisions about their own bodies and healthcare. Genetic screening, everyone, is deeply personal, and individuals might have valid reasons for not wanting to know their genetic predispositions, like fear of social discrimination. They want to avoid the psychological stress or any other personal beliefs. So, informed consent, as we all know, is the foundation of medical ethics, and that's why we should not, under any circumstances, force individuals to undergo testing, and we must respect their right to privacy. The second point is fear of social discrimination. Mandating genetic screening could lead to social discrimination against the individuals categorized as high risk, particularly in areas such as employment. A lot of employers might misuse genetic data to deny jobs or any other valuable opportunities to individuals deemed high risk. And even with legal protections, we know that enforcement is often weak, especially in Africa, and discrimination remains a significant risk. And fear of discrimination is a valid reason for individuals not wanting to know their genetic predisposition. And finally, the psychological impact. The health impact is not the only factor we need to take under consideration. We need to think about the social impact and the psychological impact as well, because mandatory genetic screening could have unintended psychological and social consequences for individuals and families in general. Learning about a genetic predisposition can cause significant anxiety, depression, or feelings of fatalism. Also, family dynamics might be strained if one member's genetic result have implications for other. That's why we need to encourage individuals. We need to support genetic screening, but we should not make that decision for them. The final decision should be up to them. And now up to Rachel.
Okay, for practical concerns, we have variable interpretation of results. And this is a valid point, especially in genetic testing. As you all know, genetic testing does not always yield clear-cut results, especially for cancer. This uncertainty can lead to unnecessary follow-up procedures and increased anxiety for patients who receive inconclusive results. To add on, genetic causes of cancer, especially breast cancer, it's a very low percent compared to all other causes. There are a lot of factors that sum up to somebody getting breast cancer. It's actually less than 30% that the genetic mutations causes breast cancer. There is environmental factors, there is epigenetics and all of that. So moving on to second point, the financial concerns of mandating genetic screening in healthcare systems in Africa. Cost implications is a very important point. Implementing mandatory genetic screening would require substantial financial resources for healthcare systems. As we all know, genetic testing is really expensive from the resources and the infrastructure. So putting this heavy burden on African health system, which is not as strong to cater for all health issues, is a big burden. This cost could strain the public health budget and divert funds from other essential health services. Not saying that breast cancer is not an important health service, but we could redirect this cost and this economic effort into other areas, such as reducing the cost of cancer drugs, as we know they are really expensive, than mandating it and really catering the cost of genetic screening for everybody in the population, which would be very high. Insurance discrimination is another financial concern, as we all know, and we've been learning in our modules that there is misuse. There could be misuse of genetic data and information in health insurance discrimination. And although there are laws, as Sahar said before, it's really when we put it on the table and are these laws practiced in Africa? It's a question to be asked. And so mandatory genetic testing could really lead to discrimination by insurance companies, potentially resulting in higher premiums or denial of coverage based on genetic predisposition. Rebuttaling on the points made by the affirmative side. So they talked about three important areas, and this is how we see their points on our side of view as the opposition side. Informed decision making, voluntary screening programs. Voluntary screening programs is the source of practicing autonomy on people and giving them informed decision making. Yes, with mandatory screening programs, you will inform them of what is going to happen, but there is still the mandatory part. Either be it fully mandatory or mandatory without penalty, giving a person a space to really understand the impact of this genetic screening and giving him or her the autonomy to really decide to go on with this test is the root of increasing participatory. So we can focus on raising awareness to the high risk populations and giving them the freedom to choose to undergo screening. And it's even shown proof that the participation in mandatory programs is quite low compared to voluntary screening programs. The American Academy of Pediatrics, for example, support genetic screening, but they emphasize informed consent and respect for autonomy. The cost factor, the affirmative side have talked about on the long run, the cost factor could be less and once already established. But we are leaving out the fact that mandatory genetic screening does not only deal with, if we're looking at the problem at large, it's not only genetic screening. We need high capital to invest in the screening itself, counseling, and follow-up care. Will African governments or healthcare system be able to cater for all of that? And this is potentially straining budgets, as I talked before, diverting resources from other essential services that we could focus on. And on the last point, in access and equity issues, yes, mandating genetic screening for all could seem as bringing equal access to genetic tests for everybody. But as the prior point I talked on cost factor, we are not sure, and as Africans, healthcare systems, we are not ready yet to cover for all of it. So will there be equal access for follow-up care? And this might even might even raise the disparities in healthcare. High costs associated with next test or follow-up care may not be covered by insurance or the government, thus limiting access for lower income population and creating inequalities in healthcare outcomes. So to conclude our arguments, we understand and really are pro genetic screening, but not mandating it. Genetic screening for breast cancer has potential benefits for high risk populations and everybody at large, since getting to the root of the problem early on could help with treatment, and mandating such tests raises significant ethical, practical, and financial concerns that really warrant careful consideration before being implemented. Making genetic screening an optional service allows individuals to make informed decision based on their personal circumstances, values, and without any undue pressure or risk of any harm. So these are the references that we use to create our arguments. And with that, thank you very much for your attention, and we welcome questions from the audience. Thank you very much.